Good morning, everyone, and thank you for joining. I hope you can all hear me okay. Today, we're here to talk about Teams, Microsoft Teams in healthcare, specifically some of the capabilities we've enabled for hospitals and healthcare, and how that would apply to university and teaching hospitals. My name is Srini Srendranath. I'm the Health Customer Lead for Microsoft Office Healthcare. I wanted to first start off with you just to talk a little bit about Microsoft Teams, if you're not familiar with it, what the product is and what it does. And then I'll quickly walk through some of the key capabilities that we're enabling in Microsoft Teams specifically for healthcare. If you have any questions while we go through this presentation, please feel free to go ahead and post those questions in the console, and I'll be glad to address them when we have a break or towards the end of the session. Teams is Microsoft's collaboration hub. It brings together a lot of Microsoft's capabilities, and it is one of the fastest growing in usage across a number of different industries. It's used very widely across many Fortune 100 customers, and it has tremendous usage even in individual organizations at scale.
Hey Srini, sorry to interrupt, but I don't see your desktop.
Oh, is it not sharing?
No. Try it one more time, sorry.
It says it's connecting. I'm going to rewind.
All right, it shows that it loading. There it is.
There it is. Great. Again, I'm Srini Srendranath, the Healthcare Customer Lead for Microsoft Teams. And today we're going to talk about Microsoft Teams and what we're doing to expand Microsoft's capabilities of Teams in healthcare specifically. Microsoft Teams, just as an introduction, is a product that's widely used across the Fortune 100 companies. It's used in scale at specific organizations with more than 100,000 users at individual organizations, and it supports a number of different languages, so it can be used to help with various different students that are coming from many different backgrounds and can help organizations collaborate together. At the core, Microsoft Teams is a collaboration platform that brings together a lot of experiences across Microsoft. So it brings together a lot of that communication capability, whether that's chat, meetings, or calling, to the ability to collaborate right next to your chats or in line with your chats, to bring files, to co-author, to co-create, to alter, to modify, to edit. And it also has an extensible platform that allows the product to be extended not only by third-party providers, but also by individual organizations for specific business case or line of business needs that might be relevant. And because it is built with Office 365, it is fully compliant, it's HIPAA compliant, it's high trust in government, it's ISO compliant, and it comes with an admin center that allows you to administer the usage, the deployment, the management of Microsoft Teams. Again, in Office for Healthcare, we really started with the notion that we needed a core, secure, and compliant platform, which Office 365 has. It has full HIPAA compliance and has government high trust compliance. And on top of that, as I mentioned, we've layered a lot of the Microsoft capabilities, including calling, meeting, broadcast, chat channels, files, shifts, and even dashboards and insights. And that's extensible. And so extensible both to bring all of Microsoft's products in, but also to bring third-party apps in. What we're specifically doing in the health situation or the health context is bringing in specific line of business applications that are relevant for healthcare organizations. And this is for hospitals, this is for clinics, this is for virtual visits, this is for managing patient intake and transition. It's also leverageable because of the other capabilities of Teams for teaching, for learning, for understanding how patient care should be delivered. We've also made some investments to bolster the core communication capabilities to be health compliant, to provide the layer of additional features that really make it relevant in a health context. As you look across many of the key coordination and collaboration scenarios across health, they span things from the simple and basic messaging between doctors and nurses about a specific patient, all the way to more complex research and collaboration and bringing in patient agreements and patient thoughts and patient care plans and making sure that you're evaluating that against how you want to deliver care, all the way to the complex multidisciplinary team meeting, where you're bringing together many clinicians together to derive specific outcomes for specific patients against a care plan that you're driving for them. And there's a lot of capabilities across this, but we focused on three main buckets where we're putting our investment. And one of those areas is around the area of secure messaging, to be able to bring a level of secure messaging features specific for health. Then we're focused around telehealth and virtual care and enabling this ability to virtually consult clinician to clinician, but also clinician to patient. And then enabling a lot of those complex conversations and communications that enable clinicians to work well together, collaborate with each other to deliver the best patient care possible. I'm going to go a little bit deeper specifically on these three areas, so healthcare messaging, care coordination, and virtual visits, starting with healthcare messaging. In healthcare, messaging is very important. The ability to quickly communicate, the ability to very quickly identify the right person at the right time to deliver the right care is almost the most critical need in healthcare. However, we've seen that there's a proliferation of consumer apps in this space, of some very, very customized solutions that have also been brought in to solve this problem. We think there is a opportunity for us to leverage the Teams platform to bring secure chat between clinicians, to allow them to share images securely and safely, to annotate images, to be able to escalate messages and do priority notifications, again, underpinned by that secure and compliant platform, but also to be able to involve voice and video, screen sharing, and other forms of collaboration. So having a comprehensive view of what it requires for clinicians to be able to work together. Some of the specific features we're working on to enable secure messaging for healthcare within Microsoft Teams are things like priority notifications, the ability to annotate images, federated messaging across multiple tenants. So you might be a hospital in one location with a hospital in another location, but you want to federate your messaging. The notion of read receipts, bringing the ability to know when your message was sent, when it was delivered, and when it was read. Also to bring in the notion of role-based messaging, because sometimes you don't need to message individuals, but you need to message an entire role type, like nurse practitioners, for example, or a specific category of skilled professionals that you want to reach out directly. And we have the ability to bring in shift and schedule management, whether through the Teams scheduling module or through our bot integration that we have with Kronos. As well, the ability to do message delegation, to be able to set someone as your backup when you're out of office or in a surgery or in some other context where you're unavailable. Looking a little bit deeper, just wanted to show you the look and feel of the group and one-on-one read receipts. When it is a group read receipt, you can see quickly by looking at the message how many people have seen that message and how many people have not seen that message. And then you'll have the history of every message when it was sent, delivered, and read. The next thing that we've worked on is that urgent messaging with priority notifications. We already within Teams have the notion of important messages. We've added another level of priority called urgent. And if a message is marked urgent, it will prompt you every 2 minutes for up to 20 minutes to alert you that this is still a pending notification for you. This is great in a clinical context where you're really trying to reach someone for something that's important, but you want to make sure you really get to them. The next step on this is to also add escalations beyond this, and then to know whether to be able to manage that escalation to a pager or an SMS or another screen in order to enable the next level of communication. The other important feature that's needed by clinicians is the ability to be able to redirect messages, to be able to take a message that, to take a day when you're off, or a time when you're off, or a time when you're blocked, to be able to set a delegate so that the delegate can receive your message in lieu of you being able to respond in a timely fashion. And again, as we mentioned, the notion of role-based messaging, to be able to define roles, to be able to define roles within your team, and to be able to make sure that those roles are being reached at the right time. And an interesting use case of this might be that if you had a group of nurses who'd been identified as roles having the ability to speak Spanish, and you were consulting with a patient who needed translation services, and you wanted to be able to connect with a nurse who specifically was able to speak Spanish, we enable you to very simply be able to look for Spanish language speaking nurses that you're starting a meeting connection with, so that you can deliver that connection and that insight to a patient at the point of need. It's also really important for nurses and doctors to know who's on call or who's working now. And so we wanted to bring in the insight from scheduling so that you know exactly who's working and when they're working, and that you can access them during their work. As a simple workflow showing the notion of that schedule being brought in, someone requesting time off, or someone requesting to ask for something else, or to request for someone else's schedule so that they know when they're working. The next main pillar of focus for us is around the notion of care coordination. And there's a lot of work that clinicians do in working with each other, in being able to communicate what's happening, what needs done, what the tasks are. And so we see this manifesting itself in a lot of different areas, whether that's a clinician-to-clinician referral, whether that's a patient handoff from a shift transition, or an MDT or IDT meeting, or some type of rounding that happens on a regular basis, or it's in the context of clinical research collaboration, where many clinicians are coming together to look at a treatment plan and how that progressed over a period of time, or to even historically look at a case study of a historical treatment plan to see what the outcomes were of different patients that endured different types of treatments. We obviously have the ability to bring in dashboards and insight. So we see a lot of different capabilities that are enabled when we think about care coordination. First, we want to talk about the notion of patient-centric collaboration. And so in order to have patient-centric collaboration, you need to be able to bring in patient insight from the electronic health record. And that's exactly what we've done, is that we've built an app within Teams using the extensible app construct of Teams to be able to directly connect through the FHIR protocol to FHIR compliant EHRs, to be able to do read access and bring in EHR insight inside of Teams. Now, we're not actually persisting the data, we're just bringing the insight into Teams so that that can then be used to be able to define next steps, to create custom lists of specific types of patients like diabetic patients or high-risk patients. And then you have the access of that EHR visibility in the Teams app, whether that's on mobile or on desktop. And it does really enhance the ability to collaborate on some patient-centric scenarios, like being able to look at a specific patient's data coming in from the EHR and to be able to see their current medications, to see their current vitals, and then also to be able to edit the columns that you see in the data that you see, but then take notes against it so that as you're processing through your day and you've worked with one patient and you want to carry on the notes and pass that on to the next patient, you have that sitting right next to you to be able to do. The other area of collaboration around care is the notion of task delegation. Whether that's tasks that are issued within a team, by a team lead, or tasks that are issued by a patient ringing a call light, there is a need to be able to take that action and turn it into actionable work that's accomplished. And so we have a task construct within teams to be able to allow the creation of tasks, the prioritization of tasks, the delegation of tasks, and have a full history of how those tasks have been handled and managed. An example of that same task being delivered to someone's mobile device, because we know clinicians are always on the move and are rarely in front of a desktop. That task comes in with clarity on what needs to happen from the nursing station. It's assigned to Brian Wright. And then Brian has the ability within the task to be able to set priorities, to be able to delegate the task, to be able to add someone else to the task. And so you have the ability to define the type of task that it is, and then also define how it gets completed. Once completed, so it was initially assigned by you to Brian. Brian then reassigned it to another person, and then that other person had that task to go complete. And then when Keon completed the task, there's a finalization that the task has been complete, and it updates everyone. So you have the entire thread from creation to delegation to marking a priority to completion, so that you know that the things that you need to get done are getting completed. So we think of those two contexts, the patient-centric insight as well as that task delegation, being used in lots of different contexts to enable coordination of care. The third area of focus for us is around virtual visits or telehealth. Telehealth is a huge and growing opportunity area, and we see many organizations making pretty strong investments in this space, buying customized systems, but certainly there is a need, because of crowded hospitals, to be able to alleviate some of that by moving more people to virtual care who can, for patient follow-up visits, for triaging some things that don't need to come to the emergency room. And so there is a pretty strong push in the industry around this, and we feel that Teams is a great product and a backbone for us to be able to build telehealth capability and virtual visit capability. So with Microsoft Teams, we see that there again are a number of different things that you can do in the context of virtual care or telehealth. We think there's a big opportunity for clinician-to-clinician collaboration, which today tends to be a phone call or a message with not enough detail or context. This allows a ability to not only have a video consult in that transition, but also to be able to do a transfer with details, with specifically pointing to items in that patient's care record, to be able to share that with the next physician. There is a desire to also do a lot of patient virtual visits, and so we have a platform that already enables third parties to join in meetings, so we're bolstering that capability by adding more things to be able to enable that virtual patient consult, that virtual lobby experience for a patient, more seamless, more brought together, and easier to be able to manage within Teams. We're working with many room systems and devices, from pan-tilt zoom cameras to a whole line of devices that can be used to be able to drive virtual care. We also think that there are a lot of things that are happening around learning and training and meetings with intelligent AI, so that you can extrapolate and translate and transcribe virtual meetings. And so we have a lot of these capabilities that we're building, and also will enable to be embedded inside your applications and your web pages and in your portals. The first piece is really enabling that clinician-to-clinician consult, and we again within Teams have both the construct of within Teams to be able to do full HD video, VoIP conferencing, to be able to do sharing, to be able to do Surface Hubs, to be able to do room systems. We also support all of the external joiners, so we have guest access for meeting joiners. We have the ability for you to collaborate with clinicians that are outside your network, but also work within your hospital system, so that you can share files and documents and have full HD discussions, as well as record the entire conversation and transcribe it. And once transcribed, that meeting that's been transcribed is searchable. So you can search that entire meeting to be able to see exactly what was discussed, and to be able to scan to a particular part of the meeting that was relevant to you by searching the transcription. We do enable the ability to meet anywhere, desktop, mobile, web browser, and actually we're enabling full RTC join on Chrome web to be able to engage the largest users of web in the world, which is Chrome. We're working across some video interoperability partners who provide some extensions to video capability, as well as we enable a lot of personal devices and shared devices to be able to make that interactive session come to life. To bring a few of these pieces together, we have a hospital system in Sweden that's leveraging secure messaging to collaborate with one another. They're using care coordination to bring in electronic health records and even some patient records insight into a multidisciplinary team consult. And they're doing it on an interactive Surface Hub whiteboard. So you can see how these different components that we're enabling can come together and enable a really vibrant virtual connection. And really, from those clinicians, it's really enhanced their ability to serve those patients. On the patient virtual visit side, we have the notion that we need to make it very seamless and easy for the patient to be able to join. We don't want to have browser plugins. We want to be able to enable them to join without having a license or doing any of that. But we want them to have a real branded patient experience from your clinical organization, so that they know they're connecting with you. They know they're connected to you. And on the provider side, we also want to make it a seamless join. We're also enabling deep linking from Teams to EHR systems directly. We have full meeting control on the provider side, as well as the ability to record meetings. So a full, robust platform to be able to engage patients, to be able to engage providers into conversations with patients and enable that telehealth construct. This is an example of how this could potentially work. I'm a patient, Eleanor. I've just logged into my healthcare portal. And within my healthcare portal, I see that I have an appointment today at 3 o'clock. I've got a general consult. And so I can go ahead and just join directly from my patient portal. When I go ahead and join that meeting, I'm given the option to be able to set my video and audio settings to my device, to be able to make sure my device is working properly. And then I'm notified that I've been entered into a lobby experience. And again, this is the part that is going to be customizable, where you can actually brand it and logo it with your experience. And after I've joined and I've set my settings, I'm notified that my appointment has started, and my clinician has been notified that I'm in the lobby. And then we have the clinician join on the other side in full HD video. This could be either on their own personal mobile device, or it could actually be in a room that's been set up specifically for virtual consults. And then as the clinician, I get to see full HD of the patient, but our vision is also, as we bring EHR data into Teams, to be able to persist that EHR data next to this virtual consult, so that in addition to seeing the patient, I can actually see their prior diagnoses, their medical history, their current medications, their current vitals, if that were available to me. And then I can also take notes on our discussion on what I need to follow up on, and make sure that those notes then turn into tasks that get sent off to the right people to be able to follow up. And so a full console to be able to enable and to engage in that virtual consult context in a vibrant way. And again, this works equally whether the patient or the clinician are sitting in front of a webcam or they're joining directly from their own personal mobile device, which is likely the more prevalent scenario in the future. Today, we have an option of Teams plus a partner video interop solution. We're very quickly going to a custom Teams meeting with the custom join via WebRTC with that branding in the lobby. And so we're very quickly moving towards that in Q1. And then in latter stages, we're actually moving towards a full embedded experience to be able to embed the Teams experience inside your own mobile app or your own web page or your own portal. Now, I've covered those three main focus areas of where we're building capability around secure messaging, around care coordination, and around virtual care or telehealth. The other thing that's happening is that we're also building some things to simplify the deployment and usage of Teams in clinical scenarios. So we've already looked at the creation of some templates for different types of care. So if that's medical operations or process huddles or care coordination, we have predefined templates that we can provide to you to enable you to get those teams up and running quickly. When you go into a team experience that's predefined, you get the team daily welcome page, which brings together conversation, some dashboards. If you have EHR connected, some recently admitted patients, and if you have schedules engaged, and you have on-call schedules of people that are working today. So you can get a day at the glance very quickly by looking across all the different things that are happening within that care team. And so we want to enable that to be a simply, quickly adoptable experience for users. And this could equally be something that you do for residents that are joining a new hospital and you want them to onboard quickly. And so you give them an onboarding dashboard that lets them bring together different pieces of experience so that they can quickly adjust to their environment. We also have a whole suite of things that we're doing around AI with the Azure AI framework and the bot framework to enable you to take slash commands and take internal guidelines and internal policies and turn them into botable command line usage constructs. And we have the same kind of thing with leveraging AI to be able to do fill-in forms so that you don't have to go back and fill an assessment form later. You don't need to go fill out a research authorization form later. You can actually do it natively within your conversational experience, and it in the background uses AI to turn that into a completed form. As well, we're looking at other devices, ambient devices, watches, smart watches, and the ability to be able to ask questions and interact with those. There's a portion of this that is around the patient and the patient getting insight for what their care is and what's their next step and where they are in the continuum of care. And there's a whole set of this that's around ambient devices that support clinicians to be able to get insight on where things stand in terms of things they ordered, things that were requested, things that they need to follow up on. So there's both a patient and a clinician bent to the AI and ambient devices capability. As I mentioned before, we have within Teams the ability to do meeting transcription, and we're adding additional lexicon to that transcription capability to specifically support medical use cases so that you can do clinical meeting transcription so that you actually get the ability to record the meeting, but also to transcript it so that you can search across it then, leveraging our AI capability in Stream to be able to zone in on the exact part of the conversation that you missed. Because all you really wanted to hear was a 5-minute segment about a cardiovascular disease that had been noticed, and you don't want to wade through a 2-hour meeting in order to get there. What I wanted to do is take some of these component capabilities that we've talked about and think about how do we turn these component capabilities into some things that are relevant for university or teaching hospitals. And these are some examples that have come from conversations we've had with some of the hospital systems. One of those is that there is a need from a teaching context to be able to do patient case studies or student mock case studies of patients and their diagnoses and what their treatments were like. And so Teams are a great construct, not only in the clinical context to use for real patient care, but to be able to bring that in a mock context way for students to be able to engage and interact with and try to make diagnoses and evaluate if their thinking is right and to collaborate with their peers. We see care being more and more collaborative in nature, where many clinicians and many teams of clinicians are coming together to deliver care. And so Teams is a great construct to be able to model that, to showcase that, to let students experience that. We also think Teams is a great, and this is something that's been asked of us, is how can Teams be used to train new residents that are in a hospital so that they can shadow an attending physician, so that they can actually belong to the same teams and see the exact same conversation threads and observe the pattern of thought and the pattern of thinking that goes into how they diagnose care, so that they can do those shadow roles directly in teams, looking at how their peers are working and how things and decisions are being made within that hospital's organization. We also see a lot of demand for nursing training videos and hands-on diagnosis and training. So there is a component of nursing and doctors teaching and education that actually happens on the job. And so the ability to be able to deliver training to them at their point of need, to them as a refresher before they go in and do a hands-on diagnostic procedure, to be able to have that, them to be able to take notes against the procedure they just completed in Teams, and to be able to persist that with the video that they had the training on. So to be able to take knowledge and insight that's coming from the classroom and translate it to the real world, and them to actually be able to use it, as well to be able to collaborate with their peers within their class to ask ideas and thoughts and to ask for insight. We also think there's a sizable opportunity around conducting research. I think there's a pretty painful process today, and I've gone through it because my parents had gone through this on their last hospital visit, of being asked to join a research, giving their consent or their approval to join a research effort. And that is quite tedious. It actually is not only tedious, but requires multiple explanations, and it's not well documented, and the papers that are given are lengthy, and there's no digital way of recording that, and there's no way to keep the patients engaged as part of a trial. And so with guest access, you actually have the ability to engage patients in a research trial, in a clinical trial of some sort, and then to curate them as guest users in an external team, and to actually keep them engaged, where they can provide feedback, where they can share what's happening next, and that can all be done leveraging Teams. So just wanted to share some sample use cases of how Teams could be leveraged both in the clinical context, but also in a teaching clinical context. I just want you to also know that Teams is actually quite tailored for education, for universities. We've got a whole set of offerings around a course community, as well around research collaboration, grant submission, peer reviews. And so we want you to engage Teams in lots of different areas. And so I wanted to make sure that we highlighted the capabilities that we have in Teams, specifically for educational institutions. If you want more insight on what Teams has and use cases Teams has for educational institutions and how it's being used at scale in large institutions around the world, please feel free to go to aka.ms/using Teams, and you'll see a lot of the use cases that are being leveraged, and you'll see videos and examples from around the globe on how Teams is being leveraged in educational contexts. I'd like to go ahead and stop my presentation there, and at this point I will address any questions that have been posted in the console, in the Event Builder console. I appreciate and thank you for joining this session. Hopefully you found it informative. You can feel free to follow up with me for additional information or to explore Teams. Please go to aka.ms and you can find more about Teams use cases there. Thank you very much. I'm going to switch now. I'm going to stop presenting. I'm going to switch to the console so I can look at any questions that have been posted and address those. There's a question about, is it possible to get a copy of the slides? Of course. We're glad to make a copy of the slides available to you. There was a question about, is the task functionality something special for healthcare? Tasks is actually a module that is core to Teams that's being built right now that'll be out in Q1 that will be available across all of Teams. It's not specifically only for health. However, we do think there is a great there's a great reason and a great opportunity to leverage that task capability specifically in Teams to enable different types of care scenarios. There's a question around how do we get access to these health templates? Yes, today what's in market is the specific university templates. A lot of these capabilities that are available in Teams are in preview. Some of them are actually fully available directly in Teams, and some are in preview. We would love to explore that further with you and engage with you in driving preview around secure messaging or virtual care or care coordination. There's another question, is there a way to enable healthcare-related Teams features in addition to the standard Teams environment? For example, a university with a medical school hospital in addition to standard classes. Yes, absolutely. By enabling Teams for those users, a lot of the work we're doing around the secure messaging capabilities are capabilities that are natively available in Teams for all users, but are extremely relevant for healthcare users. But if anyone's interested in pursuing a preview with the care coordination or exploring what we have around telehealth or virtual care, please let us know and we'd be glad to engage with you further. You can also respond to the survey that's coming out after this webcast, and we'll be glad to get you more information. The Teams templates that you saw in the slides, those actually will be coming out in Q1. So there will be healthcare specific Teams templates that are coming out in Q1. I think those are the questions. I haven't seen any additional questions. I want to thank you all for joining this session. Hope you have a great day.